Forstoffel, and I'm a cardiac rehab therapist for Flower Hospital. I have a bachelor's degree in the education of science that allows me to better understand the human body as well as its movement. Today I'm going to discuss with you all how to accurately take a blood pressure. So, on average, I take about 50 to 75 blood pressures a day. Some of my patients are sitting, most of them are either standing or actively partaking in exercise while I'm taking their blood pressure. But before I go over how to take a blood pressure, I think that it's important for all of you to understand exactly what a blood pressure is and what those numbers stand for. And blood pressure consists of two numbers. The first one, it represents the maximum pressure reached when a heartbeat beats. The second number represents the minimum pressure that's reached when the heart rests between these beats. The first number is the systolic, it's the top number, and the bottom one is the diastolic number. Now, the first beat, or the first, you might hear it called 120 over 80. That's usually how you might hear it referred to, or 100 over 60, somewhere of the sort. The first, the systolic, the 120, is the pressure to which it spikes when the heart beats. The second number, the 80 or the 60, which is also referred to as the diastolic, is the pressure to which it falls during the interval between beats. So now that you understand a little bit more of what a blood pressure is and what it consists of, I'm going to go ahead and demonstrate with you. I think now it'll be a little bit more easy for you to understand, why we are doing it the way that we're doing it. So I'm going to have somebody help me today. This is Chelsea. She's going to go ahead and have a seat for me here. Okay, so I'm going to try to break this down into 10 steps. The first step is going to be choosing the right equipment. I think that it's important for all of you to have a nice stethoscope. You will notice a world of difference in between what stethoscope you use. Personally, I enjoy using the Littman stethoscope. It's got a ball. Also make sure that you know what person you're using it for. I'm using it on adult, so I'm going to make sure it's on the adult end. If I would turn it this way, obviously this would now be for pediatric. So now that I ensure that it's on the adult end, because I'm going to be using this side of it, I can go ahead and figure out the blood pressure cuff. So this is referred to as a sphygmometer that I will be using today. So step 2, prepare the patient. All right, Chelsea, we're going to make sure that your feet are flat on the ground. You will notice that a lot of women tend to cross their legs. We cannot have that. If we do, their blood pressure is actually going to go up a little bit because their arteries are going to be more restricted. Also, make sure that your patient, go ahead and use this for you here. You're going to go ahead and have your patient ensure that her arm is about heart rate or heart level. Step 2, the patient is now ready. Going on to step 3, choosing the proper blood pressure cuff size. This is a medium blood pressure cuff. You will also know that there's a small one, mostly used for children, although I have used some on adults before, and then there's a large blood pressure cuff. So this is the medium blood pressure cuff. Notice now that it has a range along the side as well, and the particular one that I am using actually has my meter gauge on it. Some of them you'll notice they have it to the stand next to them. Most of them that you have in your office here will have them attached to it. So step 4, placing the blood pressure cuff on the patient's arm. So this I'm actually going to place over the crease of her arm. You'll notice most stethoscopes are going to have an arrow. This one actually breaks it down into 2 different ones. One says left and one says right, so we're obviously using her left arm, so I'm going to use this arrow over here. So I'm going to have her flip her arm here so I can see this nice crease, the brachial artery running right down the center, putting this arrow directly over it about 1 inch above, and I'm going to go ahead and begin to wrap this around. Now this is also a good location for me because I can now see my meter very well. I'm not having to chase it over her or back over to my side. So now that I got this nice and tight, it's not going to move up or down on me, I can go ahead and begin to move on to step 5, position the stethoscope. So now I can take my Lytton stethoscope, which I will not be putting in my ears today just because then I would hear myself through the rest of the speech. I'm going to keep it around my neck. Using the base ball of my stethoscope, I'm going to place this directly over the brachial artery. Now this is going to help me hear the pressure at the best point. So now that my stethoscope is in place, I can now begin to inflate the blood pressure cuff. So I'm going to go ahead and grab the ball inflator. I'm going to bring this all the way, turn it to the right so that's nice and tight. When I start to press, you'll notice this arm here is going to begin to go up. Now, when I'm doing this pressure, I'm going to release this for you so it doesn't get too tight. I can bring this, if I don't know what her normal blood pressure would be, I'm going to bring it up to 160/80. If she tells me my blood pressure normally runs 120/80, very average, very common, I can then bring it 30-40 beats over that for her pressure, for her mmHgs. So let's just say that. I can go ahead and begin to pump the cup up, which I'm not going to do, make you struggle here. I'm going to go ahead and pump it up to that, and then move along to step 7. Step 7, slowly deflating the blood pressure cuff. Now this is a very important part. If I pump this up all the way to where she would need to be, and I just flip it real fast, you're going to see how fast that arm is going to drop down. I would not be able to hear a darn thing doing that. So you want to make sure that when you are pressing this up, that this little hand here is not moving more than 2 bars at a time down. This is going to make sure that I can get the appropriate reading for her. AHA actually recommends that you do not let it drop in between 2 or 3 at a time. So, step 8, listen for the systolic reading. Now remember, the systolic reading is the very first beat that you hear. So pumping it up to 20-30 beats over 120, which is her normal, systolic rate, that's going to allow me to ensure that I make sure I catch that first beat. I'm going to let that drop all the way down until the last one that I hear. That last number is going to tell me what her diastolic rate is. So, step 9, you're listening for that diastolic reading. Going into step 10, which is the very last one. So now that I know, I've listened to it, I've caught the first reading when it first begins, and I've listened to when it ends, the last one, the diastolic reading. I now have my 2 numbers. So let's say you were 120/80. Now, the AHA also recommends that you do this on both arms. So if I was testing on my patients in cardiac rehab, my nurses would have already done that. So it wouldn't have been necessary for me to do it both times. Here in the office, you're going to be more familiar with your patients because you work with them, quite often. So you'll know what's normal and what's not normal. It won't be necessary for you to do both arms. Now, the first time when you're doing, a patient's blood pressure and you're not familiar with them, I would highly recommend doing both arms to ensure that you have an accurate reading. If somebody is an atrial fib or has a very irregular heartbeat in general, then you might hear, beats in certain areas. It's okay to have somebody check your blood pressure. I do it with my fellow staff all the time. If you don't feel confident, don't just make up a number and throw it in there and say, this sounds good. Have somebody double check you. It's okay. It's not, the end of the world. It happens to all of us. Some people's ears are better than others because not everybody's heartbeat is going to sound the exact same. Thus, their pressure coming out of the arteries is going to be different. So, I'd just like to thank everybody for your time and your attention. Does anybody have any questions for me today? No stupid questions? Every question is good. Usually they say that all questions are questions that other people might be thinking, but that nobody else wants to answer. Okay, well, that concludes my speech. I'll be staying after to go ahead and allow you all to demonstrate, maybe after we get some hands-on experience. There'll be more questions that will arise. So thank you for your time, and I will see you in a little bit. Thank you.